Hello, this is Dr. Scott McNabb with Emory University. I'd like to welcome you to this webinar and to invite you to participate and collaborate with us in the creation of a brand new textbook titled Transforming Public Health Surveillance, sponsored by Elsevier Publishing. This is a document and prezi to describe some of the author's guidance um, instructions, as well as give an overview of why we've um, believe that this book is necessary. We have an outstanding editing team, both in the United States as well as in Sweden and in India and also in the Kingdom of Saudi Arabia, who are here to help you succeed. The idea of the book originated from the fact that we realize that there exists new opportunities that can fundamentally transform public health surveillance from a current state of siloed systems, of the lack of accurate information that comes in a timely manner, and that these opportunities include important new collaborations, new ideas about governance, and the use of information and communication technology and tools, as well as new data sources. And accompanying those new data sources include new analytic techniques, and of course the workforce is the key part of making an effective public health surveillance systems. We think that these uh, elements of opportunities can be harnessed, so to speak, to improve the core functions of public health surveillance so that they can be enabled, enhanced, and empowered by these new opportunities. And this, of course, then would allow us in the book to describe how public health workers could do their work better, faster, and cheaper when these new opportunities are leveraged. So the vision that we have for public health information is that it's available where it's needed, when it's needed. Just like we know the global weather. From my office in Atlanta, I can go to a weather app and determine how the weather looks in Beijing and what the forecast is for the weather for the next 2 weeks. By the same token, I should be able to understand important public health problems in Beijing, especially if I'm traveling there. We believe these are global best practices. So we vision a trained workforce using the latest information communication technology and tools to access and manage the latest public health data and share best practices, where local, regional, national, and international public health surveillance networks meet uh, these needs in a very timely and responsive manner. We believe that public health surveillance should be ahead of disease outbreaks, even in terms of predicting them, so as to prevent or rapidly detect health threats before they impact communities and economies. So we believe that the technologies, the methods, and the collaborations necessary to achieve this vision do exist, but there's a gap of what the current state is and where the vision, what the vision describes. The benefits to the book, what makes this book unique, are that we take a comprehensive system approach, meaning that we're looking at a One Health concept, including veterinary and human health. We look at multiple cross-industry perspectives, including the private sector, the public sector, and of course the medical healthcare sector. We think about forward-thinking solutions to important public health problems. We take an integrated and innovative analytics approach. There's some really exciting work being done on new analytics. And we also want to focus on the use of modern information communication technology. In other words, the emerging bleeding edge of what's known as public health informatics, the digital application and these important engineering tools to enhance the flow of public health information. And of course, then we also want to address the new and important developing competencies for the workforce of the future. And we take a real applications approach, meaning that we've developed out 6 public health scenarios that the authors will write to. So these are real-time events in our current world situation. We believe the audience for this book would include public health practitioners, epidemiologists, informaticians, other health professionals, as well as the higher education community in teaching the important core points of public health surveillance. And we expect and hope that our book will impact policymakers, that this creation of this, the laying out of this new vision will in fact impact change. The overview of the sections of the book, there are 7 sections, including the vision, and the chapters within that section include past contributions, the next generation of collaboration, what are the issues, what's on the horizon, and then we move to the second section where we try to address the question, where are we now in the current state of public health surveillance? The chapters within that section include models of public health surveillance, integrated versus siloed surveillance systems, economics of public health surveillance, reactive versus proactive public health surveillance, workforce capacity, supply and demand, the new matrix for evaluation of surveillance systems, and the application of a new public health surveillance model. Then we move to the question that naturally occurs in the logic of this, how does it look from up top, and addressing governance, which is a critical component of achieving this vision. We talk about policies, standards, and best practices of public health surveillance, integrating public health and global security, the linking of those two components, ethics and norms, solutions for global governance of public health surveillance. Then we move to the question, what are the linkages? And we discuss in this section collaborations. We talk about One Health, as I mentioned earlier, the combination of veterinary and human health, contributions of the military public health surveillance to global public health, how societies can enhance collaboration. We talk about the important intersection between clinical medicine and public health, and how to engage communities. Then we discuss the important question, how does the data flow through the use of surveillance informatics? We talk about interoperability and creating connections, data storms with all directions working together, sustainable informatics infrastructure models, and the human interaction, visualization and manipulating information. And then we talk about how this information can be modeled using the new public health analytics, the new analytic approaches to accessing public health data, the challenge and necessity of verification and validation of public health data, modeling public health data, and applied interdisciplinary translational research in public health. And then finally, we want to address what's in the future or the potential impacts if this vision is achieved. We talk about the achievement of the health-related Millennium Development Goals and beyond, and guiding research and innovation, and finally facilitating health equity and sustainable development. So there are 7 sections conceived in the book with 31 chapters. The public health scenarios that I mentioned earlier provide a baseline teaching opportunity, and they will be presented in the appendix that frame a series of models representing various public health circumstances that have happened in our own memory. Each chapter will provide key points relating to the scenarios, and they include the new novel coronavirus outbreak, which is currently emanating from the Middle East, the epidemic of diabetes in the global public health arena, methicillin-resistant Staph aureus, the tsunami nuclear disaster that occurred, especially impactful to the Japanese, to the country of Japan, the pandemic influenza public health emergency of international concern, which occurred in 2009, as well as exposomes. The first authors of the book are a scientific team that represent diverse disciplines, and it's necessary for us to recruit first authors who come from a variety of different disciplines, because that is a part of the future of this vision of public health surveillance. And so we have a commitment to Elsevier, who has been very supportive of this effort to comply with the ethics guidance that Elsevier gives for authors and for publications. And so we have on our website a discussion of the major types of scientific fraud and misconduct, and what Elsevier considers to be publishing ethically. So for our authors, we provide background and support so they understand fully the issues around publishing in an ethical way. Each contributor, that includes each first author as well as co-author of each chapter, will be asked to sign a contract from Elsevier, and we're in the process of negotiating that right now. The processes we plan to undertake are that we have a a pretty strict publishing timeline, that we have an expectation of 15 pages per chapter, and that we have a proportion due for submission, as you're seeing in this table, 20% due this summer, 40% by mid-September, 60% by mid-November, and then our expectation is that we would complete the book, the composition of the book by the middle of December, and then we have a due date of 1 March of 2014 to file it with the publisher. The guidelines for each chapter have been considered and thought through, and we wanted to make certain that each author had certain guidelines to write to. So there should be, we have provided an outline and described the content of the deliverable for each of the section editors to provide to the corresponding chapter leads. In the outline, we would like each author to consider certain guidance, and the section editors provide that guidance to the authors. And we have an author's guidance document that we provide to each author, and then a document which is called Appendix 1, which is a book overview, which discusses each section, each chapter, and the bullet components of each chapter. And as I think we've tried to describe, there is a linkage between the sections, an ordering of it, as it were, and also within each section there's an order or a linking or a harmony among the chapters. We would like for the authors to begin with the current environment of public health in their particular topic area, to discuss what might be available in terms of achieving this future vision, then to discuss the goals that would be necessary to achieve the final vision, both in the short term and the long term, to talk about impediments or limitations to achieving those goals, and then to highlight best practices with a real focus on ground truthing and what is the methodology. So we want the authors to choose one or more of the public health scenarios or develop one of their own and describe the context of their book chapter within this real-life circumstance. We expect, as I mentioned, a chapter or manuscript to be around 15 pages with figures, illustrations, and tables that are original, with a summary of 8 to 10 key bullet points, and then a listing of 8 to 10 discussion questions per chapter, finally with a specific illustration of job competencies necessary for the workforce of the future for public health surveillance. There's a style guide that Elsevier provides for authors that includes formatting, figures, tables, etc. So there are very explicit instructions on formatting that will be used by our authors in writing this book. And we've created a Microsoft Word dot file, which is so-called Appendix 2, which allows the author to comply with all the formatting issues related to the book, so it makes it easier for the author in his or her writing. Of course, the figures, tables, and illustrations should be original. If we use materials from another publication, the editor will talk with Elsevier to discuss getting permission and acquisition of that particular intellectual property. We've chosen EndNote as the tool to manage references, and Cite While You Write, which is a plugin for Microsoft Word, so that the authors can learn and make it easier for them to reference their work. And we provide this YouTube clip on how to use Cite While You Write. The publishing company has asked us to choose Vancouver style referencing, so it'll make it very easy by the use of EndNote and Cite While You Write. References will be automatically pulled into the document from the master reference database. So we have tools that we have employed as we work on the cloud to make this process easy. We use GoToMeeting, which is a teleconferencing tool so that we can collaborate anywhere at any time. And we use also the Dropbox for file storage and manipulation of draft copies and iterative control, etc. And then finally, as I mentioned, we use EndNote to manage and share citations with ease. So all of these, we think modern 21st century cloud-based tools and technology plus the guidance and the vision should produce our output. And we're really looking forward to working with all of the authors of each chapter to produce a very, very high quality, thoughtful, down-to-earth